Statistics show Utah has a shortage of primary care doctors, especially in rural communities in southern Utah.
You've seen the growth here in southern Utah, and so being able to keep up with the demand and the growth is really impactful. And I think also just a general interest to be a primary care physician maybe hasn't been as great. Just because there's so much they have to do.
There is a real shortage of primary care in this region across the state, but even more so in our rural communities, and this is particularly so in southern Utah.
Leaders from the University of Utah Health and Intermountain are joining in a new collaborative effort to try and close that gap by hosting clinical training on the St. George Hospital campus.
Primary care is the gateway for your health system, right? And so most individuals need to start with a primary care physician who can really understand them as a person and follow them across the continuum of care. And so that's one of the areas in which we haven't had a large number of physicians is primary care. So being able to be part of that solution and helping them have that experience here in southern Utah is really a great benefit to southern Utah.
Recently funded by the Utah Legislature at a cost of $6.5 million, the new program should kick off in 2027 and will allow for 10 students each year.
They do just an initial exposure, a first year in Salt Lake, but then they translate down here for their second and third and fourth years of medical school, and then finally for their residency training as well. So the idea is an integrated program with the vast majority of the time spent down here in this area. 10 students per year, so a total in a medical school class of 40 overall in 4 years.
The St. George Hospital also partners with Rocky Vista University in Ivins for medical students to get their clinical rotations.
And so that physician will take that student and show them what they do and help them learn the ropes, just like we do with our nursing students or imaging students. So they'll just be following a physician and learning how to be a physician.
The hope is that the on-site clinical training will encourage primary doctors to serve the needs of local communities.
It will be a unique experience where students who are really focused on having their ultimate practice here in this region have the chance to start their experience as medical students, and then their later graduate training, and then finally, we hope, stay here to serve the needs of this community.
And even though the University of Utah Health and Intermountain are separate medical providers, they have teamed up before in partnership at other healthcare facilities.
For example, our primary children's hospital is an Intermountain hospital that's completely staffed by University of Utah doctors, and many of our other residency programs have collaborative efforts with Intermountain. So yes, we are two big health systems in the state of Utah, but there's more partnership than you might imagine.
In St. George, Melissa Anderson, Community Education News.